What is it specifically that nurses are asking for? Because it's it's not in line with inflation, it's above inflation.
Yeah, they're asking for 17%. And I think your viewers watching, however sympathetic we all are to nurses, we know everyone is struggling with the cost of living, and particularly we know that there are these huge structural problems in the NHS. But people at home, people working in the private sector are not going to be getting anything like 17%. I do think that that's not reasonable. And I think patients will be very, very worried about the impact this is going to have on their care. In children's hospitals, it's cancer hospitals, it's operations delayed yet again after the pandemic. I think this is, frankly, a bit irresponsible.
OK.
I guess the trouble is they've consistently been falling backwards with real terms pay. Their pay goes back. They see GPs get huge pay rises. The average GP what's on 110,000 a year. Good luck if you get to see a GP, because I can't remember when I last saw one. Can't see them at weekends, difficult at the evening. Nurses work 365 days a year, 24/7, in all weather, rain and shine. And they're paid around, what, about £32,000?
I think there are other aspects of the pay. I mean, it depends where you work. That's actually, that's difficult to live on in London, but it goes further elsewhere. They also have more generous pensions than many other areas of the public and the private sector. That's not to say that there aren't, serious problems in the NHS. We've got hundreds of thousands of vacancies. People are leaving the profession at a rate of knots because it's, frankly, an unpleasant working environment a lot of the time. So we do need to look at the working conditions. But 17%, it's unaffordable. We know the state of the public finances. They just don't have £9 billion to give to nurses.
Yeah, and look, Steve Barclay yesterday, the Health Secretary, saying, look, we really do appreciate the work that the nursing community does. And he said that they've committed to accept recommendations of the independent pay review body, which is 1,400 for over 1 million workers. But as you say, there is a huge discrepancy between 3%, which is what nurses were given last year, and 17%, which is what they're asking for now. But there has to be an awful phrase, but a landing zone in the middle somewhere.
Yeah, I mean, basically they have to come to an agreement, don't they? I don't think we can, in all conscience, allow this strike to go ahead when we're already facing winter pressures. We've already got this huge backlog from the pandemic. I think they're going to have to meet in the middle.
Do you know, I think that this will raise the debate also, should nurses be able to go on strike? Because police officers can't, army officers can't. Should nurses be able to go on strike? Should doctors be able to go on strike? We're talking about a minimum level of service in the railways by law. I wonder if that's something now people are going to have to look at.
I think they'll increasingly lose public sympathy.
That's what I think will happen.
And I think there will be increasing calls to limit their power to go on strike. I mean, they're going to keep emergency services going, but anyone out there who's got a chronic condition or an operation or a child, people are going to be really, really worried about what's going to happen, and I think they're going to lose sympathy, as I said.
It's when also we can say, because there was the nursing cover wasn't it, somebody could die because of this.
People will be in danger.